And UW Health Chief Quality Officer, Dr. Jeff Pothof, joins us now. Welcome back.
Hi, Dr. Pothof.
Good to be here.
What is the situation here with hospitalizations?
Yeah, so there is a bit of a surge of RSV right now. I think if you look at UW Health data or American Family Children's Hospital, compared to last year this time, the number of positive RSV tests are up about fourfold. So pretty good increase. The health system has been busy all the way around. It's been that way, for several months now, and that's why we are a little bit concerned if we see an increase in RSV on top of influenza, and then if we start to see some increased COVID cases this fall going into winter, it might get hard to manage everyone's healthcare needs that needs a hospital.
When you have a label like triple-demic, it sounds a little bit alarmist, but it is a combination of three of those viruses. Of those three, which one are you most concerned about right now?
Right now, today, it's RSV in our pediatric population. For the last 2 years, kids have been masked. There's a lot of kids who haven't been exposed to RSV that otherwise would be, so we're kind of getting, 2 years worth all at one time and a little bit earlier. And most kids with RSV do absolutely fine, but, if there's a lot of cases, even if a small number of those need hospitalization, it can end up being a pretty significant amount that end up in the
And they all
hospital.
spread the same way, right?
They all spread the same way, so they're all respiratory viruses, whether RSV, COVID, or influenza. So important to wash your hands, avoid going into public places when you're sick, and for influenza and COVID, you can decrease your likelihood of coming down with it if you get yourself vaccinated.
Are adults are they threatened by RSV?
Older adults, especially those who are immunocompromised, can have a rough course with RSV. Most of us, once we're past the age of 2 or 3, we do pretty well with it, and then it starts to become a problem once we're over the age of 65.
Okay. I got an email today from a viewer who wanted me to ask you if it's possible to get a Novavax vaccination.
For COVID.
For COVID.
Yeah, absolutely. So Novavax kind of snuck in there late in the game. It's the 4th approved vaccine. There was Johnson & Johnson, and then Pfizer and Moderna, which are the most common. And then Novavax, which kind of uses old school technology, which some people prefer if they're not certain about this mRNA technology. So you can get the Novavax vaccine. It works on par with kind of our original COVID-19 vaccine. I think the one drawback of Novavax right now is we now have these Omicron-specific boosters for our mRNA vaccines. Those are desirable. Novavax doesn't have that yet.
And where would you find a Novavax? It's never on the list of what you can get.
Yeah, you might have to call around, but most places or some places will have Novavax vaccine, so it's out there. It's just not as easy as like looking up any Walgreens or CVS to find it.
So vaccination's the key here.
I think vaccination will keep volumes down so that we have a better chance of having room in the hospital for everyone who does come down with flu that needs to be admitted, or COVID or RSV, but also for other things that people need to be admitted for, whether it's heart disease or stroke or things that we see right now. So getting vaccinated is doing your part to make sure that there's capacity for people in our hospitals when they get sick.
Absolutely.
Right, and if you have questions for Dr. Pothof, be sure to reach out to us, and
absolutely.
we'll pass them along.
Yeah. See you next week.
Great to see you.
We'll see you then.